Bismillahirrahmanirrahim. My name is Dr. Mohammad Abbas Qureshi, and today we're going to talk about the surface tension and the surfactant with the reference to the mechanics of the lung physiology. So, what is the surface tension? Surface means the surface of something, and it is taken as the surface of the liquid, and above that is an air. So it is the interface between the liquid and the air. So the above most surface, it has the molecules in it, and they have the attraction forces. Like within any gas or any liquid there are these molecules which are dispersed everywhere, and they have covalent and they are intramolecular forces and will attach to everybody. But when there is a surface, when the for example, this is the amount, this is a line of a demarcation. Below there is a water, above there is a air. So this surface molecules, they do not have the forces which are towards upward, because the molecules and the chemistry is changed. So they have greater forces with the side by side surface molecules, and they creates a tension there. So there is a complete sheet, a stable sheet of surface of the molecules of that particular liquid is made, that creates this surface tension, on which sometimes you will see some insects are walking on the water itself, because they are using that surface tension to do so. So now when we talk about the lungs, we know, we just read about the compliance, that lung has the compliance which depends on what, which depends on, obviously, which is inversely proportional to the elasticity, how much elastic tissue is in the lungs, and which is inversely proportional to the stiffness as well. One more thing that the lung compliance depends on is the surface tension between the alveoli, because in the alveoli there are water at the lining of the alveoli, and that create a certain form of surface tension, and that surface tension tends to collapse the alveoli. So what happens when there is this alveoli and there is water in this, and the surface tension wants to collapse this alveoli, it wants to make it go like that. So this entire surface tension in the entire lung is proning to collapse this lung, and is anti expansion. It is making the lung less compliant. That is what the surface tension is. Now there's a certain detail to it, and it says like the surface tension is more in the smaller alveoli and it is less in the bigger alveoli. So when the alveoli is really small, the surface tensions are so close, molecules are so close, the surface tensions application is huge. There is a thing which is produced by the type 2 alveolar cells in the lungs, known as the surfactant. This surfactant is usually the DPPC, which is the dipalmitoyl phosphatidylcholine, which is a sort of a thing that comes in between, and it disrupts the forces of these surface tension creating intermolecules and make it a lesser tense, and that will reduce the surface tension, and that always works. The application of this thing is in the neonates. When you have the newborn babies, especially the premature babies, you would find the ARDS very common there. Why is that? Because the surfactant is not yet ready. So it is ready, it is almost ready at somewhere like the 35th week of your gestation. Sometimes it is very early, but usually you would find that it is not present when the premature baby is born, and that would lead to decreased compliance. Why? Because there is huge surface tension, and the surfactant is not there, the lungs want to collapse, and the compliance is not much. It is difficult to expand the lung, it does not have the distensibility, and that will lead to further infections into it, and the lesser oxygen leads to the ARDS in the kids. So that is one application of it, and for that you might give the steroid shot before the premature birth, because that will increase the surfactant. Also the surfactants are available that you can give the baby through the EDT. So that's all about the surface tension.